My name is Neil Lalaiko, and I am Director of Pediatric Gastroenterology at Hasbro Children's Hospital, the pediatric division of Rhode Island Hospital in Providence, Rhode Island. I am also Professor of Pediatrics at the Warren Alpert School of Medicine at Brown University. I was asked by the editors of Clinical Gastroenterology and Hepatology to discuss our paper, Factors that Determine Risk for Surgery in Pediatric Patients with Crohn's Disease. Dr. Mark Schaefer, now a faculty member at Penn State School of Medicine, was training with me at Hasbro Children's Hospital, and we undertook this study to answer the question, what is the incidence of surgery in children with newly diagnosed Crohn's disease, and what factors determine that risk for surgery? The work was the result of the combined efforts of the 26 members of the Pediatric Inflammatory Bowel Diseases Collaborative Research Group Registry. The registry was developed to prospectively describe the clinical and humanistic outcomes of children under 16 years of age newly diagnosed with inflammatory bowel disease. At the time of our study, the registry contained over 850 children from the United States and Canada who were diagnosed with Crohn's disease during the 6-year period between 2002 and 2008. An examination of the published literature suggested a wide range of possible answers to our main question. Some authors reported that as many as 47% of children would require surgery within 5 years of diagnosis. A retrospective chart review of pediatric patients diagnosed between 1979 and 2003 suggested a much lower incidence, and the most recently published paper from a large study in France reported that 34% of children with Crohn's disease would require surgery within 5 years. We were also hoping to see if the increasingly early use of immunomodulators might alter disease progression to surgery. The children studied came from 26 different centers in the US and Canada, and each was treated according to the dictates of his or her own doctor. The management of these children reflects the changes in management that have occurred during the 6-year period in which they were diagnosed, and in general reflects the increased use of immunomodulators and biological agents over the last decade. Uniform data was collected at diagnosis, 30 days after diagnosis, and quarterly thereafter, as well as at the time of any hospitalization. 40% of the children were begun on immunomodulators within 30 days of diagnosis. Overall, 9% of the patients underwent a first Crohn's disease-related surgery. At 1 year, the cumulative risks for all Crohn's disease-related surgery was 4.8%, and at 5 years from the date of diagnosis, the cumulative risks for all Crohn's disease-related surgery was 17.7%. The risk of bowel surgery was increased by older age of diagnosis, greater disease severity, and change in behavior of disease from inflammatory to stricturing or penetrating disease. The risk of bowel surgery was less in patients with disease located between the transverse colon and the rectum. The risk of bowel surgery was not increased by initiation of immunomodulator therapy within 30 days of diagnosis, by sex, race, or a family history of inflammatory bowel disease. Over the 6 years of the study, there was no statistical difference in the outcome by year of diagnosis, nor was there evidence of a trend to improved outcome over time. So in summary, in our analysis of pediatric patients with Crohn's disease, the 5-year cumulative risk of bowel surgery was 17.7%, which is substantially lower than that reported in the most recent studies of adult and pediatric patients. Additionally, the initiation of immunomodulator therapy within 30 days of diagnosis did not alter that risk. Future work needs to focus on preventing inflammatory disease from progressing to penetrating and stricturing disease. This work would not have been possible without the collaboration and cooperation of the centers of the consortium and the wonderful research coordinators at each of the centers, and especially important in this work were the magnificent and brave families and children who participate in our Pediatric Inflammatory Bowel Diseases Collaborative Research Group Registry.